team at AIDS Resource Alliance really works to help address those social determinants of health and provide patient-centric care to those who don't typically see it in rural areas. From the moment you walk in the door until the moment you leave, it's very evident that this is a warm and welcoming clinic for the HIV community and the LGBTQ community.
We have a wide geographic area that we serve throughout north central Pennsylvania. Our nurse's office is here at the front of the hall. It does a lot of the coordination with our patient visits as well as coordinating client services. Kelly is our patient case manager. She helps us kind of with sort of social determinants of health. She's really important in helping us connect our patients to resources for housing and food insecurity and transportation. And she's really a direct result of our grant from the AstraZeneca Foundation. We've been able to bring her on board. We're super excited to have her to help us with that. The organization sort of had its roots back in the 1980s. Really sort of started out as a support group and really as a way to help people who were dying of AIDS who had no sort of resources. That group kind of turned into an AIDS service organization, and that's just caused the agency to be able to have like dedicated social workers, but we never had direct medical care here. We're happy to have a place to be able to do our evaluations and our clinical assessments. We have the availability to do all the sort of basic kind of lab-based stuff like, blood glucoses, urinalysis. It's really great that we can do as much as we can for folks without having to send them anywhere else.
Our tour was a great tour today. What an eye-opening experience it was. Not only to see the facility, but to see the dedication, the great work that this team is doing here. Each of these events brings on a new perspective of how these organizations are using, our grant dollars.
I'm so proud to work at the AstraZeneca Foundation. We're able to fund operations like AIDS Resource, who are helping to identify and treat unmet gaps in care.